On today's World Insight, G20 health ministers convene online. How can health officials coordinate global efforts while tackling outbreaks at home? And we speak to Chinese CDC Director Gao Fu. He explains how COVID-19's behavior makes it such a daunting pandemic.
This virus is unknown, but also this is a virus from its family. It's always human-to-human transmission.
Here is our host, Tian Wei.
Hello and welcome to World Insight, coming to you live on CGTN from Beijing. I'm Tian Wei. We start today's program with the united global efforts to fight against COVID-19. Health ministers from the group of 20 major economies held a video conference on Sunday. They shared national best practices and also focused on prioritizing COVID-19 pandemic preparedness. The meeting follows an online summit of G20 leaders in March and comes at a time when infections have been reported in more than 200 countries and regions around the world. Before my discussion with three experts coming from China, Italy, and the United States, the three epicenters of COVID-19, let's take a look at this first.
Health ministers of the G20 held a virtual meeting on Sunday to share experiences and preventative measures to contain the spread of COVID-19. Dozens of representatives from G20 countries and the World Health Organization were joined by other participants from Spain, Singapore, Jordan, and Switzerland. Saudi Arabia hosted the meeting. The video conference meeting touched upon digital medical services, critical case treatment, vaccine research, and the pandemic's impact on all socio-economic fields.
First, we urge each of your countries to continue to fight the pandemic with determination, guided by science and evidence. Second, we're looking to the G20 countries to continue to support the global response to COVID-19. Third, we call on all G20 countries to work together to increase the production and equitable distribution of essential supplies and to remove trade barriers that put health workers and their patients at risk.
Ma Xiaowei, China's Minister of the National Health Commission, said that China is still vigilant despite cutting off the vectors for domestic COVID-19 transmission and has brought production and life back to normal. He added that China has provided equipment to 127 countries and 4 international organizations and has sent expert teams to 15 countries. At the online summit of G20 leaders in March, Chinese President Xi Jinping called for enhanced anti-epidemic information sharing and promoted containment protocols. He advocated a collective response against COVID-19. As of Monday, the number of confirmed cases has passed 2.4 million globally, with over 165,000 deaths.
For more on the G20 Health Ministers meeting and its result, we are joined by three guests coming from China, the United States, and Italy. Via Skype in Rome, Giovanni Razza, who is the Director of the Infectious Disease Department at the Italian National Institution of Health, also known as the Italian CDC. In Providence, the United States, Dr. Megan Rani, an emergency physician from Brown University. She's been very vocal about helping the doctors to get the PPE they urgently need. And in Shanghai, China, we have Chen Hong, Executive Director of the Asia Pacific Studies with Center of East Asia Normal University. Gentlemen and lady, welcome to our program. I want to start by asking very briefly from the three of you, you are coming from epicenters of COVID-19 at different stages. Tell me what's going on in your country now. If we can, 20 seconds for everyone. Ms. Rani, you want to go first? United States.
Sure. So here in the United States, we are still seeing rises in the number of COVID cases and the number of deaths. We currently have well over 40,000 COVID-19 deaths across the country, approximately 70,000 people who have recovered, and around 700,000 who have tested positive. The numbers have plateaued in some of our biggest epicenters. So New York City, for instance, is starting to report that the number of cases and the number of deaths is staying steady. But we're not yet seeing major decreases anywhere in the country, and we are seeing a rise in some new spots. So we are very much in the thick of it right now here in the U.S.
In the thick of it. And also Dr. Reza, coming from Italy.
I mean, things are going better, fortunately. We had really a very bad outbreak in the north of the country, near Milan, the region of Lombardy, and in the near regions of Piemonte, Emilia, and Veneto. But fortunately, now it's going better. We implemented the complete lockdown on the 11th of March, and now the number of cases is decreasing. Also, the the parameter that is indicative of the transmission probability is going down, but we still have a high number of deaths because this is the last indicator to decrease. But anyway, I would say that the situation is better, and now the government is talking about implementing the phase 2 at the beginning of May. We'll see.
We'll see. A breath of fresh air, but we don't know what's coming up next. Mr. Chen from China,
yes.
What's about China?
Yeah, in China, I think actually things are coming back to normal in a gradual and prudent way, as we see that actually factories are being kicked start and consumers are actually being encouraged to go back to restaurants and shopping malls actually, but of course still you see people wearing masks everywhere in a very careful way, so people are still practicing social distancing and also self-protective measures, while on the other hand, be encouraged to be more, open to come back to normalcy.
I see. Of course, there are still reports of clusters of cases in China. In Beijing, for example, where I am, Chaoyang district is one of those areas. Having said that, though, let me ask you, related to the G20 health minister meeting. Now, this is rare, okay? So no health minister meeting before this for the G20, but this is the very first time and very important, yet it did not reach any communique at the end of this. Dr. Reza, how should we understand this?
Difficult to say. Unfortunately, there was not world cooperation, and also within the EU, the European Union, there was no much cooperation. That was one of the main problems, because we had not standardized policies or strategies, and actually each country decided to implement different modalities of containment. But fortunately now, there's some discussion going on, and also, I hope that this meeting will start a new cooperation era. Actually, we had doctors from and also equipments from China, from Cuba, from Russia, but also Germany started to give hospitality in their hospitals to some of our patients. And now we are discussing about the possibility of having common policies, but it was quite difficult. It was quite difficult at the beginning.
Coordinated efforts for prevention and control, that has been raised an issue in the health ministers meeting, Dr. Ramney from the U.S., by quite a number of them. For example, the latest I checked, coming from China, from Russia, from Canada, and also from Japan, to say the least. Dr. Ramney, do you think that's likely to happen? Given the first stage, there seems to be very different opinions and finger-pointing still.
Well, we're still working on coordination within the United States right now, and as you know, President Trump has said that he is going to defund the U.S.'s support of the WHO. So I'm not incredibly hopeful that we're going to have great coordination in the short term between the United States and other countries. I will say that many of us in the public health world are very much pushing for that, because we know that this virus knows no borders. It does not stop at the edge of a country just because someone has drawn a line there. So we are trying to encourage cooperation, certainly supporting it scientifically, and hope that our government and other governments will be able to join forces to help both increase preparedness and decrease the spread of the virus.
We understand, Dr. Rani, as you mentioned, that the failure of reaching a communique, which has been the hope of the international community at the end of the health ministers' meeting, has a lot to do with whether the U.S. wanted to support WHO or not.
So I obviously don't control whether we support the WHO. I will say that here within the United States, we are still very much working on trying to coordinate between our own states. We're still in a situation where individual governors have to almost bid against each other, where hospitals find that their orders of PPE are getting taken and diverted elsewhere. So we're still trying to figure it out internally. Again, the public health community, scientists very much recognize the importance of supporting the WHO and of coordinating on an international level. The federal government has made some changes in its opinions over the last couple of weeks, and I'm hopeful that we will redirect funds there soon.
Mr. Chen, halting of the WHO funding from the current U.S. administration has been the biggest news. However, over the weekend, Mr. Chen, the world's artists, popular artists particularly, has been organizing and trying to donate to WHO and the United Nations efforts against the COVID-19. More than $100 million have been raised there. Having said that, how should we understand the consensus really has already been there, whether one or two countries are having problem with it, for the support of World Health Organization?
Yes, this is a global pandemic, so that's actually calls for concerted, conjoint efforts globally. In other words, just like the global virtual concerts, which can be actually happening, it is not only a concert, but also quite symbolic, indicating a global, aspiration of, this kind of conjoint effort to defeat the disease. So WHO is actually a very important flagship, coordinating, global efforts about, pandemic and combat, and also other, epidemic eradication. So these actually international bodies are very, very important because it is, actually symbolizes a kind of like a conjoint, endeavors to defeat their disease. So I think actually this particular time of crisis, we need, special, coordination. Yes.
But, Mr. Chen, if I could, since you're coming from China, WHO has been accused by the current administration in Washington about being China-centered. Do you agree with that?
Well, certainly, I think actually it is very narrow-minded to point fingers at WHO about being China-centric, because WHO is actually a global body. It actually, looks after, health issues globally, not just about one country. And actually to point fingers at China, with regard to WHO is particularly, paradoxical. In particular, I think actually it is because of the Trump administration, in the against background of the November election, trying to have its political gains. That is actually to be using, China, WHO as a pretext to for its particular political, interest. But generally speaking, I still think actually this is a very narrow-minded accusation.
Let's put politics aside because we're talking about lives. Let's talk about lives. What about that, Dr. Reza? Whether this will be the end of the phase 1 for the European countries and the United States, and we don't know what's likely to be phase 2. So from lockdown, shutdown, to partial opening of the economy, to gradual going to the total opening of the society. We are doing it very carefully, step by step, and we don't know what's likely to happen. Dr. Reza.
I think we should be very cautious about reopening all the activities. For sure, there's a discussion in the society, at the political level, in the scientific world, also in the scientific community, about how to reopen some activities, because we had just complete lockdown that was tougher than the lockdown implemented by other European countries. And the slogan was, stay home. And actually, we stayed home for more than 1 month. And now the things are going better, and everybody are talking about this phase 2. But phase 2 means to reopen some productive activities for sure. But we say, we advise the government about being cautious and keeping social distancing measures implemented again, because otherwise we said, the virus is going to circulate anyway.
But Mr. Reza, is the government going to listen to you? And also, more importantly, is the public going to listen to you?
Yeah, that's the point, because the government, is very sensitive for sure, to the industry, to the managers of productive activities, because they want to reopen in some ways, because otherwise they say, the economy of the country will really become very, very bad. And at the same time, also the public, they are going to be a little bit tired about this quarantine, strict quarantine measures.
Yes.
And so it's very difficult to get a compromise, but I think that will compromise in some way. There will be a reopening of some productive activities, but at the same time it will be partial and gradual, because we had to keep some social distancing measures anyway, even in the phase 2.
Dr. Rani, in the United States, of course, you already said that you're still in the middle of it, the thick of it. The state of New York particularly, we also see other states also. What's your take about whether there's likely to be a relatively control of the phase 1 and smooth it up to gradual opening of the society?
So here in the United States, it's really going to be occurring on a state-by-state basis. Some states never put strict restrictions in place or are already loosening them. In the state of Florida, they've already reopened their beaches. In other states like Rhode Island, where I live, Massachusetts, Connecticut, New York, where we're tremendously hard hit, our governors have created a coalition to try to create standard guidelines for when we will start to reopen. And I will say that here in the Northeast, we are nowhere near that yet. We don't yet have adequate testing. We're not seeing the number of cases go down. My worry is that as some states reopen early, they're then going to see infections go up and spread it back to other cases. So we're still trying to figure out the best strategy here. Again, for right now, it's largely being done on a state-by-state basis rather than on a federal basis.
We don't know, right, Dr. Rani? I mean, in a pandemic, what we can do without a vaccine, without therapeutic treatment, that is to have social distancing. So once social distancing eases, we don't know what's going to happen later. We don't know how the public is going to react to that. On that, Mr. Chen from China, there has been some period of time over the past few weeks, China, different cities coming with their own plan. They have different plans, own plan to do the opening up. What do you think? Is it been successful? How do you see the people's fatigue of lockdowns and social distancing, but at the same time their fear of the virus, all at the same time?
Yeah, I think actually in China, in different places, like in different areas, depending on the severity of the spread of the virus, people have different reactions. So, but generally speaking, I think actually there is a cultural issue. People in maybe Confucius culture are more, prone to, be subject to accepting a kind of regime which is more, to be observing, rules and principles. So that actually social distancing and also even, travel restriction, those measures have been observed quite successfully. That is why actually in Hubei, in Wuhan, in many cities and areas in China, things are actually gradually coming back to normal. Of course, there are imported cluster infections, such like now in Heilongjiang, in some areas, but generally speaking, in the whole country, things are actually coming back to normal because of the early, success and efficacy.
Yes, but what about
of
next? The question is not about the earlier, but rather about what's next, because people already certainly feel the exhaustion of, always being cautious and different from their earlier lifestyles. But we don't know, right? We still have this fear, so people still want to obey by the guidelines. But there might be a point that the society have to balance on a constant basis about what to do and what not to do. So that's really the complicated issue involved. Having said that, though, I do want to ask all of you another very important question. So
yes,
you all said smartly that the virus does not respect the border. Okay, so if without international coordination of prevention and control, all doing it at the same time with utmost efforts, always the virus travel, come into the easiest crack and then conquer the world. So are we seeing signs that the world is likely to be united now after all of this effort in terms of what's next, prevention, control? Dr. Rani.
So to be clear, this virus has already conquered the world. It is already pretty much everywhere where there are humans in the world right now. What we have been trying to do is to slow its spread so that our healthcare systems can catch up and to give our most vulnerable citizens across the world the chance to live until there's a vaccine or effective treatments. I would love to see international coordination to stop the spread further. I'm just not confident that it's going to happen in the short term. It would be ideal. It would be great to conquer this the same way that we've done for smallpox and other diseases, but we don't have a vaccine yet, and we don't yet seem to have the political will on an international basis to make that type of coordination happen.
Dr. Reza, vaccine at least at the end of the year or early half of next year. Okay, it's still a long time to go. So what are we going to do now? We know, we do not know, but we still need to do something, Dr. Reza.
Yeah, for sure. We need global surveillance and control of the infection. So we had to connect each other in order to get a better surveillance of the spread of the virus. And each state should be coordinated with other states in order to alert, where there are hotspots of transmission and how we can control them. At the same time, we should standardize in some way control and prevention activities. At the same time, coordination is needed in order to push for having results from randomized clinical trials on treatments, and the regulatory agents should be also generous about authorizing randomized trials and of vaccines, and also at the end to authorize a vaccine if we
I can see a long laundry list of tasks you just said, Dr. Reza. I hope we'll be able to make it happen, and also with coordinated efforts, because we cannot fail individually. It means collectively, too.
Right.
Having said that, though, I want to thank the three of you for your contribution to the discussion. Thank you so much for your efforts. Megan Rani, Giovanni Reza, and Chen Hong. Really appreciate it. Be well. Thank you. You're watching World Insight with me, Tian Wei. Still to come on our program, we speak to Chinese CDC Director Gao Fu. He explains how COVID-19's behavior makes it such a daunting pandemic. Welcome back. You're still watching World Insight. I'm Tian Wei. The COVID-19 epidemic is a major public health emergency that has spread around the world. So what exactly is the virus, and how similar is it to the rest of the coronavirus family? For those questions earlier, I interviewed Dr. George Fu Gao, the director of the Chinese Center for Disease Control and Prevention. Let's listen in. How much more do we know about it since January?
What I can see from this is the 7th coronavirus infecting human beings. 7th. We already have 6 we know it's infected human beings, but none of them really behave like this. This is really a special one. For example, from first incubation period can be as long as 14 days, even longer. And the second, for the virus city, and you might have the virus really, can last for more than some reports say could be a month or something. That's like a chronic, like a chronic disease, a chronic virus. Yeah. And also, the virus can survive in some surface, some area for a long time. For example, in a sewage. You never think this kind of, because it's an old-developed virus. It's not a non-old-developed virus. You can also detect the virus from your digestive system. That means 1/3 of the patients, they have the virus in their stool.
Right.
So that's, really the behavior of this virus doesn't like it's a coronavirus. So we never think, it can go like this. Right. So this is why, to be honest, we know less than what we should know. And we know less what we know. So we really need to know more about what we don't know.
The sequencing suggesting about 80%, if I remember right, compared to what we knew earlier about SARS, for example, from bats. Now, do we have further studies of that? Do we have any latest information regarding it?
When you are talking about 80%, that's the average. So this is a coronavirus. Coronavirus is a single-stranded RNA virus. When you say single-stranded, that means the whole genome starts 0 to 30,000. It's a linear, you call it linear sequence there. But those linear fragments, different kind of functional fragments, can be derived from different viruses. We call it recombination. So for this virus, you can see some area, some fragments, they can 98% identical to SARS, but some fragments, some area, like receptor binding site, receptor binding fragments, we call the S, it's only less than 70% with SARS. So average, 80%. So this kind of virus is known for its recombination, i.e., you got one fragment from one precursor, the other fragments from the other species.
That's right.
So it's very hard, very difficult, sometimes for you. This is why we are talking about get the whole genome sequencing to compare where the virus from. When you are talking about the origin, a good example is MERS. So we know MERS, from the cumulative science, we know the virus is from bat. That's for sure. But the problem or the question now is whether or not there's another mammals, another animals between bats to human. So maybe it's bats direct jump to human, but most likely there's an intermediate host.
But it's like lottery, isn't it, in a way, Dr. Gao? Because you really have to try everything in order to know it. But apparently, at that time, when doing research, you tried the one-hump camel, and it worked. It told. So what would that mean for all of us now? It would took forever to eventually find out what is the immediate host, if there were one.
We are, I say, the scientist community. We are working very hard. I don't know whether or not we can have a quick answer soon. Maybe it takes time. And in the history, so many pathogens, so many viruses, we never got the origin of that virus. So many examples. Once you have this virus jumped, maybe this virus, now we think it's jumped, maybe, just recently. It could be a long time ago. They already have sporadic, occasionally, they infect human beings. Just, suddenly, they obtained the ability to infect the population.
So there could be a lot of possibilities,
yes,
actually.
That's right.
Since the start of the COVID-19 outbreak, the country has sent various expert teams to Hubei province. with the joint efforts of the whole nation, the positive trend in preventing and controlling the epidemic in China has been constantly consolidated and expanded, and the restoration of normal production and everyday life has been quickened. And Dr. Gao Fu, in the interview earlier, responded on the human-to-human transmission, which is a key issue in the prevention and control of the epidemic in China. Dr. Gao, another thing. When did you travel to the city of Wuhan?
On the 17th, the Commission decided to have a senior advisory group to go there again. I'm one of them. We have 6 members, including Dr. Zheng Nanshan, Yuan Guoyong, Li Lanjue, Zheng Guang, Du Bing. So we went there, and I think we got together in the evening of 18th. So we went to the hospitals and we talked to the doctors and all this. On the 19th. On the 19th morning. Yeah. And in the afternoon we have a group meeting. Of course, we already got the conclusion. It's clear.
So you were not, if I just clarify here, Dr. Gao, you were not involved in the earlier 2 batches of scientists and virologists being sent to Wuhan by the National Health Commission?
No.
You were not there?
I'm not in that.
Part of that.
Yeah.
So, Dr. Gao, can anybody in the world today be able to tell when it began human-to-human transmission?
We published a paper in New England Journal of Medicine the end of January. By then, and also my colleague, Dr. Wang Chen and Cao Mi, they published a paper in Lancet, also at the end of January. So from then, retrospectively, we try to dig out all this data. So we realized maybe the human-to-human transmission occurred late December.
When were they infected? Probably it has to be also traced back even weeks before they were discovered, right?
Yes, that's right. Yeah.
Because of the incubation period.
Yeah.
All right.
Now back to the the wholesale market. In that market, from the very beginning, all the clusters and all the let's say all is not a good word. Now, if we go back, from the very beginning we thought it's all, but now it's most.
Right.
Okay, most of the cases, they are from that market. That definitely directs you to investigate in that particular market. You realize all these patients, they have some connections. Of course, even from the very beginning, you have 1 or 2, some cases, they have no, I call it no evidence to have a direct connection with that market. Pay attention to the word I'm using, evidence. So you look at, I remember one of the patients from the 27, no close, but when you talk to the patient, when you do this investigation, it looks like there might be some clue. He or she might have some connections.
Right.
So we don't have the evidence, but we already suspected there might be human-to-human transmission or person-to-person transmission. And more importantly, based on the knowledge, based on the understanding of other coronavirus we know, there must be a human-to-human transmission. The only thing is whether or not it's very serious, whether or not, it is so popular. Or if there's human-to-human transmission, is it limited human-to-human transmission? Or is it really very efficient? Or is just, as a general, rate of the transmission?
Talking about that, I still want to come back to the human-to-human transmission, because there were enormous amount of reporting and also social media tweeting going on, a mixture of facts, imagination, misinformation, all at the same time. So it's very hard for people now, even as a professional like me, to figure out exactly what was the information being given at the time and what exactly was the nature of that communication taking place in China and elsewhere. So, Dr. Gao, please help me with it. Have you ever said in public that it is not human-to-human transmission?
That's a very good question. I never said anything about there's no human-to-human transmission in the public.
So I want to put this on record. You have never said that before in public.
No, I never said no human-to-human transmission in the public. Never, ever.
Dr. Gao Fu is a world-renowned virologist. His research focuses on the cross-species transmission, or host jump. This is when a virus jumps from one species to another, particularly from animal to human. During the 2014 Ebola outbreak, he led the China Mobile Test Laboratory in Sierra Leone, playing a key role in fighting against the epidemic. As the expert in the field, though faced with some controversies, he still defended the credibility of every word he said. So how does he instill a sense of collective responsibility during the onset of an outbreak? Dr. Gao explains this to me.
Even for a public health worker like me, or also a virologist, and of course, again, science-based. When you are talking about science-based, first, knowledge is a part of a science. That's what you know before. And also, that's a perspective part. That's a retrospective part. Perspective part. Based on whatever you know, how would you see in the future for that part? So that's the science. So science gives you a chance to predict something. So when you make any public comment, you based on the past knowledge, you based on the perspective of the future. So this is how you make any comment as a scientist. Even from the very beginning, I don't think it's good or it can put any scientist in a position to say there's no human-to-human transmission, because this virus is unknown, but also this is a virus from its family. It's always human-to-human transmission. So the only way you are looking for evidence. You are detective. So like you are a detective try to figure out the suspect. And then maybe finally you are looking for that particular criminals. But from the very beginning you have so many suspects. Like you are a detective. The job for us as a public health worker, we are detectives. The only thing is, for a detective, they are looking for someone in the same species. For the virologists, for the public health workers, like in this case, we are not the same species. We are human beings, they are virus.
So you're trying to say, Dr. Gao, that without evidence, you would not rule out and you would not say for definite either whether it is human-to-human transmission.
No.
And therefore, the public, when you said that, whatever statement you made over the past few months, could come to their conclusion up to interpretation. Is that what you're trying to say?
Yeah, about the mask wearing. We know mask wearing is very important, the important part of the strategy or measures. But again, still in some countries, including some countries in North America, some countries in Europe, they are still waiting for the evidence, scientific evidence to support
yes.
Their claim to encourage the public to wear the mask. Right. That's all. It's so clear. And even though in China that's already a routine practice, still people need for the evidence. I can't give you if you put it on the other way, don't say this is a human-to-human transmission or this is a pandemic. If we put this event back, if only there is only very, very limited human-to-human transmission, but you exaggerated too much, you put too much effort or work. For example, early January, you already introduced lockdown or containment measures. Can you imagine what would happen? So this is why the dilemma for a policy making for the public health issue. I mean, you can see this from why we sacrificed so many lives in Europe, even more than in China. You would think, well, because we already know China has taken this lockdown or containment method, we know this is very serious. Yet, in some areas, they are still experienced by the end such a disastrous, process. It's a pity, but well, so that's the whole process. For the scientists, especially I want to mention, for the public. Again, public involvement public understanding is the basis for the policy making.
Right.
So otherwise, you always this dilemma.
You mentioned a very important phrase, which is evidence. But in an ongoing process of discovery, evidence could come early, it could also come late. Then how decisions should be made in terms of evidence or not yet having evidence? So what are the priorities from a virologist perspective? Some you might suspect, but you don't have evidence. Yet the suspicion was based on retrospect,
Yes.
understanding. Some you have evidence, and therefore you should focus on it, and yet you don't want to exaggerate it or talk about it out of proportion. So this is a very interesting and delicate fine balance we're talking about, Dr. Gao.
You are using a very good word I usually use, balance. Balance is everywhere, especially when you're talking about evidence-based. So now we are living in a world, it's always evidence-based science, evidence-based medicine. This is why you have evidence-based medicine. So evidence are the key for you to make any decision. I think this kind of is a war. In China, we usually see this kind of war as the people's war. So when you are talking about the people's war, means you got to get everybody to be involved. So I call this kind of war is all the people, for the people, by the people. So this is the war. Who is doing this war? Us. So this is our own war against the virus. So this is why it's a war of us. And this is the war by the people. You got to have everybody to be activated, everybody to be involved. For example, the isolation, quarantine. If no one follows your rule for this quarantine and isolation, you are not in the business. And we say for the people. So you are working so hard. For whom? For everybody. So this is why I call this kind of war is over the people, for the people, by the people. And social distancing is the key. But if people didn't realize they need this social distancing strategy, so they will still walk around, they still visit the park, they still go for bars, and then how can you win this war?
Right. That's my interview with Dr. Gao Fu, Director of the Chinese CDC. Please tune in tomorrow as we continue our discussions with Dr. Gao. And that will do it for this edition of World Insight. To find out more, you can always search World Insight CGTN or check out our YouTube channel. Follow us on Twitter and Facebook. From me, Tian Wei, and everyone on the World Insight team, thanks for watching. Bye.